Thank you, Senator. Senator McCormick.
Thank you, Mr. Chairman, and thanks to you and the ranking member for convening this, and thank you all so much for being here today to help bring some of these critical issues to Americans and Pennsylvanians to light. Ms. Kennedy, more than 30 million Americans live with rare diseases, yet fewer than 5% have an approved treatment. Since, as you mentioned, since early 2025, the FDA has issued at least 23 complete response letters for rare disease therapies, while advisory committees' use has declined dramatically. So when late-stage rare disease applications raise concerns, what alternatives to issuing a complete response letter should the FDA use, including advisory committees or structured post-approval commitments, to resolve issues without restarting the entire process?
Thank you. We appreciate that question. So FDA has it at its disposal, thanks to Congress, many types of engagements between sponsors and the agency. Many of those have been made possible thanks to the user fees. And we're concerned that many of those meetings and meeting types aren't occurring, and that the CRLs are being utilized as a way to perhaps maybe even clear the docket or create delays. There could be a lot of reasons why that might be happening, but there are meeting types that have been implemented that could enable engagement to answer questions that sponsors and the agency might have. We saw actually the agency deploy this during the pandemic, the COVID pandemic, where we saw rapid, real-time resolution to a crisis in our country, and the agency was able to interact with sponsors, get questions answered in real time, and then we saw that CBER tried to operationalize that in other places and spaces. We would really, as a rare disease community, like to see that operationalized within rare disease, because we believe that our rare disease community has the urgency and unmet need that matches that of a pandemic, of a crisis. Yeah. We have individuals in this room who have very limited life expectancies. And if we don't address what's happening in rare disease with that same sense of urgency, they would not be here with us if we were to convene this hearing another year from now.
Yeah. Thank you. Thank you for highlighting that urgency, and I think we feel it, and you're helping us to feel it, so thank you for that. Mr. Campo, just on the issue of accelerating the process, I was taken by the fact in preparing for this that some countries are moving much faster on rare disease therapies. The European Union's FAST EU program caps multinational clinical trial authorization at 70 days, and Australia allows many trials to begin almost immediately after an ethics approval. So what's going on here? What will happen if the United States fails to keep pace, and what policy changes should we consider in the Congress given what appears to be a much more streamlined approach in other places?
Thank you, Senator. Completely agree. I think the United States has been the beacon of biotechnology innovation for so many decades, and it's part of why we have more therapies approved today for rare diseases than we did decades ago. And I would acknowledge legislation like the Orphan Drug Act that led to that. But as we said in our testimony and many of the panelists here today, we've now stopped keeping pace with innovation. And I think one exact point, which I raised in my testimony as well, is speed to clinical trials. And for me, on the one hand, it is time for patients, and taking weeks, 70 days would be a remarkable number. And I think Congress could work with the FDA to pass legislation to encourage, again, centralized IRBs, leveraging digital technology and artificial intelligence to help us do that, reducing regulatory requirements. For sure, those things could speed us into the clinic. The other piece, I think, which is sitting behind this is our national competitiveness and in some ways our national security. And when we think about Australia, we think about Europe, collaborative nations, et cetera, there are other nations out there that perhaps we see in a different way. And from my perspective, whether you think of that as a security threat or whether you think of that as a threat to getting drugs to patients, in either case, I think Congress can take a leadership role in helping the FDA to speed through that process.
Thank you all for being here.